Welcome to the Enluxtra Self-Adaptive Wound Dressing in service. Enluxtra is the first dressing of self-adaptive class. It is designed to reversibly change its function according to the feedback it gets from the wound, which makes it truly an any wound dressing. But what does self-adaptive mean exactly? It means able to sense the changing needs of a wound and functionally adapt to them. For example, let's take a look at a wound. If a wound is dry, Enluxtra's function would be hydration. However, when the wound environment starts changing and the wound unexpectedly starts exuding, the dressing at this area and this area only senses the change and switches its function from hydration to absorption, while all other areas continue to hydrate the dry parts of the wound. And if the wound stops exuding, the function of the Enluxtra would revert back to hydration. Self-adaptive dressing is designed to dynamically balance the evolving moist wound environment, providing hydration or absorption depending on the instantaneous needs of wound and peri-wound skin. Fluid from exuding areas is absorbed and locked in. Dry areas of the wound stay properly hydrated. Enluxtra possesses unprecedented absorptive capacity and fluid lock-in ability without drying the wound. The absorbed exudate becomes tightly locked in the dressing and stays there even under high pressure, body weight, or under compression wrap. Enluxtra self-adaptive dressing size 4" by 4" keeps up to 150 milliliters, 5 ounces. Size 6" by 6" keeps up to 350 milliliters, 12 ounces. On highly exuding wounds, Enluxtra can be left for 5 to 7 days. On moderate, low, and dry wounds, up to 7 to 10 days. Enluxtra protects the healthy surrounding skin. Dressing removal is non-traumatic and painless, as the dressing does not adhere to the wound. Removal can be accomplished in one piece with no need for saline or solution. Self-adaptive dressing greatly reduces pain and odor. Because Enluxtra self-adaptive dressing creates an optimal moist environment at all parts of the wound, it helps eliminate the risk of desiccation. Enluxtra does not support bacterial growth in the wound or inside itself. It offers drug-free bioburden reduction due to its unique lock-in function. Dressing holds absorbed exudate with its harmful components and bacteria away from the wound, as well as depriving the bacteria from water, thus impeding bacteria multiplication. Enluxtra does not need secondary film dressing. Enluxtra has embedded microbial and fluid strike-through barrier film, which is also breathable. Self-adaptive dressing prevents scab formation when the wound is too dry, and skin and wound edge maceration when it is too moist. When wound has optimal moisture balance, all aspects of healing are improved. Self-adaptive dressing supports granulation, reepithelialization, and new skin remodeling simultaneously within the wound. This results in faster healing and improves the aesthetic appearance of the healed wound site. Self-adaptive dressing works for all wounds including acute wounds, lacerations, graft wounds, donor sites, trauma wounds, postoperative surgical wounds, superficial and partial thickness wounds, burns, and chronic wounds, pressure ulcers, venous ulcers, arterial ulcers, diabetic ulcers, leg ulcers. The Enluxtra self-adaptive dressings are available in 6" by 6", 4" by 4", and 2" by 2" sizes. Choose a dressing size that is larger than the wound. Allow significant overlapping. Allow for more skin overlap in the direction of the natural exudate flow to help the dressing trap and lock flowing exudate. The greater the distance from the dressing edge to the wound, the lower the chance that exogenous bacteria will get into the wound. Also, the larger dressing size, the more exudate will be absorbed and the longer the dressing can stay on the wound. Do not trim or cut the dressing unless its edge interferes with body parts or patient movement. Always allow the largest dressing overlap possible over the peri-wound and intact skin. If the wound site is larger than the size of the dressing, you can use 2 or more dressings placed on the wound side by side and taped together. The application of Enluxtra is a very simple and straightforward process and can be described in 3 easy steps. Step 1. Cleanse the wound bed according to your facility's protocol. Step 2. Place the appropriate Enluxtra dressing size on the wound fiber side down, making sure the backing side is facing out. Step 3. Secure the dressing. Enluxtra is a non-adhesive dressing, so it is advised to use tape and/or an appropriate wrap to keep the dressing in place, including any types of compression wrap. It is important to always make sure the dressing is in contact with the wound bed. If a void is present between the dressing and the wound bed, and the dressing is bridging over the wound bed, the dressing placement is incorrect. In order to sense the wound, dressing must be in good contact with the wound bed. If you are not sure if the dressing is touching the wound bed, press it from the outside with a few folded gauze pads with a size smaller than the wound size. If the dressing is in contact with the wound bed, the dressing placement is correct, and you can wrap or tape over. Enluxtra dressing works very well if placed over a deep cavity or tunneling wounds. Pack the cavity with any moist wound filler of your choice: gel, folded gauze, packing gauze strips or ropes, etc. The filler transfers the exudate up to the dressing. Enluxtra absorbs and locks the exudate in, preventing exudate accumulation in the filler and wound cavity, and protecting the wound edge and peri-wound skin from maceration. Enluxtra wound dressing is not designed to be used as a wound filler. For moderate and low exuding wounds, or dry wounds, the dressings may be left on for up to 10 days. On highly exuding wounds, 5 to 7 days. Enluxtra dressings may be efficiently used as an alternative to vacuum-assisted drainage management, VAC, for wound drainage management. Unlike vacuum-assisted drainage management, Enluxtra dressings are applicable for wounds with slough and do not cause skin maceration. In comparison with VAC, Enluxtra provides dramatic simplification and cost reduction. For heavily draining wounds with copious exudate, or when Enluxtra is used as an alternative to VAC for drainage management, the dressing overlap has to be increased and should be at least 1.5 inches. The larger the margin, the longer the dressing can stay on wound. Allow even more overlap in the direction of the expected exudate flow under gravity. The only sign that the dressing is over its absorbing capacity is leakage from under the dressing edge. Gel bulging and/or material color changes that extend almost to the dressing edge and are visible through the backing film are normal. The exudate is locked inside the dressing and will not cause skin maceration. Less frequent dressing changes result in faster healing. Slough removal is made easy with self-adaptive dressings. Enluxtra facilitates autolytic debridement of slough, making painful, sharp debridement unnecessary or less frequently required. The slough removal protocol is also simplified. Rinse the wound with warm, sterile saline before each dressing application. Do not wipe the saline from the wound bed. Change dressing 2 to 3 times per week for the first 1 to 2 weeks, or until about 80% of the slough is removed. Then the dressing may be changed weekly until the wound is healed. In cases where incontinence is involved, the dressing edges must be closed by water-resistant adhesive tape. Make sure to leave enough distance from the dressing edge to the wound. Remember, the more the better. Remember to position the dressing to allow more dressing overlap in the direction of expected exudate flow under the force of gravity. If necessary, Enluxtra may be trimmed to fit the wound. Shape and cut it to fit the wound site, including at least 3/4 inch allowance. Enluxtra dressing works very well on heel wounds. Just cut slits into the dressing and secure each side with adhesive tape. Further secure with a wrap to ensure full contact with the wound bed. For a cluster of different small wounds located close to each other with intact skin between the wounds, the cluster may be covered with one large dressing instead of a number of small dressings. The dressing takes care of each wound independently and protects the skin between neighboring wounds. While using Enluxtra dressings, keep in mind, Enluxtra dressings are not hemostatic and not recommended for management of heavy arterial bleeding. Some hypersensitive patients may have allergic reactions. In case of skin reactions, you may use an additional wound contact layer dressing to separate Enluxtra dressing from the skin. With Enluxtra, the moist wound healing standard of care is automatically ensured. The dressing selection process is finally guesswork-free. Enluxtra works for any wound. It absorbs and completely locks exudate, prevents maceration, hydrates dry areas, reduces pain and odor, and serves as a microbial and fluid strike-through barrier, all at the same time, all in one dressing. Self-adaptive wound care technology turns current multiple dressing materials chaos into order. Medical professionals get efficient, guesswork-free patient visits, optimized and simplified workflow, decreased inventory, and patients get faster healing and better quality of life. The expiration date can be found on each product box. Enluxtra is covered by Medicare under the trade name Enluxtra Humifiber. HCPCS codes A6196 for sizes 2" by 2" and 4" by 4". A6197 for size 6" by 6". Major distributors of Enluxtra include McKesson, National Rehab, Medline, Advanced Tissue, Homeline, Mercy Surgical, Advanced Care Solutions, Prism Medical, and others. Thank you for taking the time to learn more about the Enluxtra self-adaptive dressings being used at your facility. For more information or to view our case studies, please visit our website, www.anywound.com, or call us toll-free 888-519-2297. Please ask us questions by emailing contact@osnovation.com or on Facebook, www.facebook.com/osnovation.